My name is Unoma Grant and I'm the Chief Operating Officer at Paelon Memorial Hospital. When the pandemic started in 2020, a number of challenges were thrown up in the Nigerian healthcare system, starting from an unwillingness to treat COVID to just an unpreparedness for a pandemic. When Paelon decided to go into the care of COVID, we had a number of challenges that we had to overcome in order to be able to keep our patients alive and, to treat as many people as possible. One of those challenges was an oxygen shortage. There was no oxygen everywhere in the country, and the prices of oxygen soared, and a lot of patients died because there was just no oxygen to treat them with. While we had the equipment, the ventilators, everything else, there was a limited resource. And so this plant helped us be able to provide oxygen for the patients who at least were able to be on ventilators, and at least we were able to provide oxygen to those people. Since we started treating COVID, we've treated between 2,000 and 3,000 people, out of which about 200 have needed to be on oxygen. And all of these people have benefited from the steady supply of oxygen that we have in the hospital. And this is mostly thanks to the plant. IHS Nigeria played a huge role in our ability to treat COVID. When the pandemic hit, Paelon was willing to treat but unable to afford what it would take to set up a hospital that will allow us to treat COVID and treat it safely and successfully. IHS rose to the occasion and contributed from ventilators to this oxygen plant. And without IHS, I dare say that we would not have been able to treat as many people as we were able to, and definitely not as successfully as we were able to. Well, this plant has provided a lot of scale for us, and not just for COVID treatment. As you can imagine, having our own oxygen plant has allowed us to comfortably pipe oxygen throughout the hospital. And so now all our oxygen dependent patients, whether COVID or just intensive care patients, will now have direct access to oxygen in their rooms. We also have direct access to oxygen in our theaters and our labor room. So any patient treated in this hospital who requires oxygen has direct access to oxygen now due to this plant. And also for our neighbors in the area, if there are any emergencies, we're willing and able to donate or sell oxygen to people who need oxygen to treat their own patients as well.